From leeches to lasers. The evolving relationship between humanity and venous disease. Opening shot. Time-lapse of a bustling city. People walking. Slow close-up on legs, some with visible varicose veins, moving through the crowd. Narrator VO'd. For as long as we have walked upright, we have battled a silent, gravitational foe. It's a story written not in history books, but on the very bodies of humanity. It's the story of venous disease. Cut to ancient Egyptian papyrus illustrations. Then to classical Greek statues. Narrator. Our relationship with it is ancient. The Egyptians documented leg ulcers on papyrus. Hippocrates spoke of heavy legs. For millennia, the veins slow. Arduous work of returning blood to the heart against gravity was a mystery, and when they failed, the tools were as crude as the understanding. Dramatic, but slightly darkly comedic, reenactment. A medieval barber surgeon figure prepares tools. Narrator. Enter the leech. Shot of leeches applied to a leg. Historical illustrations of bloodletting. Narrator. The logic was simple. Bad blood, visible as bulging veins or discolored ulcers, must be removed. Leeches were the precision instruments of their day, draining the excess. For centuries, this was the pinnacle of venous therapy, a symbiotic, if grotesque, relationship with nature. It offered relief, but no cure, grounded in a fundamental misunderstanding of the circulatory system. Quick cuts, Da Vinci's anatomical sketches, William Harvey's drawings of the heart and veins. Narrator. The turning point came not with a treatment, but with a revelation. William Harvey, esse 17th century description of blood circulation, gave us the map. The problem wasn't bad blood, but faulty plumbing, tiny one-way valves inside our veins that had weakened, allowing blood to pool. Shift to black and white footage. Early 20th century operating theater. A surgeon performing a large incision. Narrator. Armed with this knowledge, the 20th century declared war. The relationship became surgical, aggressive. If the great saphenous vein was defective, it would be stripped out, pulled from the body through 2 incisions. It was effective, but brutal. Recovery was measured in weeks of pain and scarring. The message was clear. The diseased vein was an enemy to be eradicated at a significant cost to the patient. Modern, clean hospital setting. A doctor performs an ultrasound on a patient's leg, the screen showing real-time blood flow. Narrator. Then, a new philosophy emerged. What if, instead of declaring war, we could perform a precision retirement? The late 20th century brought the duplex ultrasound, giving us Superman's X-ray vision to see exactly which valve had failed. This changed everything. CGI animation. A catheter is inserted into a vein. Different minimally invasive techniques are illustrated. Narrator. The new goal. Seal the problem vein from the inside, and let the body reroute the blood through healthy pathways. First came radiofrequency ablation, using heat. Then intravenous laser therapy. Fiber optic laser that delivers targeted energy. Close up on a medical monitor during a procedure. It is calm. The patient is awake and chatting. Narrator. The laser, a symbol of futuristic technology, became the new leech, but instead of drawing out a perceived impurity, it precisely closes the vein with minimal trauma. Recovery shrank from weeks, 2 days, 10 to hours. Scarring became virtually non-existent. Montage. A patient walking in after a procedure, leaving the same day. A cyclist on a road. A nurse on a 12-hour shift. Narrator. The relationship evolved from one of mystical extraction to radical excision to minimalist intervention. We moved from treating the terrifying complications, the massive ulcers, the debilitating pain, to preventing them altogether. The focus shifted from disease management to life enablement. Shot of a modern researcher in a lab, looking at a 3D bioprinting machine or genetic models. Narrator. And the evolution continues. Today, we look to genetics to understand why some veins are predisposed to fail. We're exploring pharmacomechanical techniques, bioadhesive glues, and even the potential of regenerative medicine. The vein itself is no longer just a culprit, it's a subject of profound biological study. Final shot. A diverse group of people of all ages walking through a park, living active lives. The camera gently tilts up from their legs to the sun through the trees. Narrator. Our journey with venous disease is a microcosm of medicine itself. From the humble leech to the focused laser beam, it reflects our own journey from superstition to understanding, from invasion to elegance. It's a story not just of conquering a disease, but of learning to work with and within the incredible machinery of the human body. To walk, to run, to live unburdened. Thanks for watching. Like, subscribe, and follow. Watch more such videos.